This program is brought to you by Community Trust Bank, Medical City, and the Neely School of Business at TCU. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome back everybody to Platforms, the life-lifting news program for women. Our next guest is Dr. Eric Mendeloff. He is the Director of Congenital Heart Surgery here at Medical City Children's Hospital. As you can see, we have a beautiful co-host named Asher, a young man who's 4 weeks old, one of Dr. Mendeloff's patients, and his beautiful mom, Amy. Dr. Mendeloff, Amy, welcome.
Thank you. It's great to be here.
It's a pleasure. Doctor, you're one of the, really one of the world's leading surgeons in this area, pediatric heart surgery. Why don't you give us a little background about this little guy for our audience, when you operated initially on him and what the problem was?
Well, as Amy would tell you, we actually knew that there was a problem before he was delivered, and this we found on fetal echocardiogram that one side of his heart didn't develop well. And without getting too belabored about it, we have two sides to our heart, one that pumps blood to the lungs and one that pumps blood to the body. But when you have only one side of your heart, that side has to be used to pump blood to the body, and so we have to figure out other ways of getting blood to the lungs. And the surgery that Asher had was related to that, and we typically do that surgery in the first 4 or 5 days of life.
Now, Amy, when was the diagnosis made before Asher was born that you determined there was a problem?
At 20 weeks during our ultrasound, we found out.
So this was a congenital issue, a congenital heart defect. Okay.
That's correct.
So you knew once you gave birth that this was going to be, this procedure needed to be done.
Right.
Okay. Dr. Mendeloff, I know you're a big fan of the FACT program here and your team. That's a very integrated approach to bringing in critically ill children and then involving the family. Tell us how that whole program works.
Well, actually, it was the reason that one of the main reasons I came to Medical City in the first place was not the FACT program itself, but the fact that there are top-notch specialists in all areas, all under one roof. So that includes fetal echocardiography, high-risk OB, maternal fetal medicine physicians, and then delivering these babies, a neonatal intensive care unit that can take care of critically ill newborns, obviously a surgical facility here, and then a post-operative care facility. But the idea with the FACT program, and Asher's a testament to this because, he had, as we know, more than a heart problem, is that when we know about these babies ahead of time, we can integrate their care with all the necessary specialists all in one place and have it be a very cohesive, patient and family-oriented approach to taking care of them.
Doctor, why don't you walk us through the procedure, because I'm looking at this beautiful, gorgeous baby, and he's so tiny at 4.5 weeks, but you actually operated on him when he was just a little over 1 week old.
Yeah. And,
wow. So the initial surgery was for the heart, right?
The initial surgery was for the heart, and as I alluded to earlier, really the surgery was focused on finding a way to get blood to his lungs, because the one side of the heart of his that is developed, it really has to focus on pumping blood out to the body. The way that blood was getting to his lungs when he was born is actually through an alternate pathway that is part of fetal development, but that actually spontaneously goes away. And there's an accessory blood vessel in fetuses, but once they're born, that accessory blood vessel actually is a part of it spontaneously closes up.
Wow.
And so we put him on a medication to artificially keep that blood vessel open so we could get him stabilized for a few days, and then we did a surgery that augments that actually, where I sewed a little segment of tubing from the artery that goes out to his arm down to the artery that goes to the lungs. And in doing that, now some of the blood going out to his arm goes down to the lungs, and that's how the lungs are getting their blood. And that's a temporizing thing for the first 5 or 6 months of life.
Right. Amy, how did you feel? I know you were nervous. I mean, open heart surgery for an adult is traumatic, so here you're putting this tiny little boy under the great hands of Dr. Mendeloff, but it had to be very unnerving for you initially, obviously.
Yeah, it was very scary, but we had a lot of faith in Dr. Mendeloff. We've heard nothing but good things, so.
And it was a very successful surgery. But doctor, you also discovered something else with little Asher. There was a second surgery. So what was going on there?
Well, one of the things, and again, this is a testament to why these kids need such a comprehensive approach, and that is that one of the things that we realized about him was that the heart defect that he was born with is actually sometimes associated with other things going on in the body. Specifically, sometimes the intestines can be inside the abdomen in a way that they're not supposed to be. And in fact, that can ultimately be a lethal problem if you don't diagnose it.
Right.
And so knowing that he had that possibility, we did a study that in fact did demonstrate he had what we call malrotation of the intestines. And as a result, after this little guy got through his heart surgery, he had to go back for another surgery to have his intestines rotated, reoriented. Yeah. That's right. And so really, he's been such a tough little guy and has done such a great job.
Yeah, he's great. Let's ask, just for our audience perspective, operating on such tiny patients, you and I, before we went on, you were saying that all the equipment and everything's just kind of minimized like you would expect it, you know.
Yeah, it's all very, very delicate instruments, and of course, as I also said, we operate with loops on, sort of what a jeweler will look through to look at a nice diamond or something like that. I have a pair of glasses that have a loop on each lens, and so everything's done under magnification.
That's wonderful. Amy, once he came out post-op, talk again about the support system you got here. Now, you've been with your baby for the last 4 weeks, and you're well rested, and there's all kinds of facilities here to take care of mom as well as the baby, which is critical.
Right. There's a bed in the room, so I get to stay with him in the room and, you know, just have that peace of mind. I know he's okay. He's right there, and they have a shower. They feed us. It's kind of like being at home, but
yeah, but doctor, honestly, isn't it true that you have to take care of the whole family? Because
Absolutely. As a matter of fact, you know, I can't explain to Asher what I'm doing for him for his surgery, and we of course met ahead of time, and the fact that we have a facility here where mom can be here with them, it helps to have great families too, because they're great listeners. They integrate. It's a very, very stressful situation, and while we have the support personnel here to support them, they also do a great job of integrating the information, staying well grounded. To say it's a very vulnerable feeling to have your child have to undergo 2 surgeries in their first month of life is so they've done a great job as well. But yes, we have we try to integrate the family into all phases of the care and keep them.
That's critical.
Yeah.
Well, hold that thought, folks. We're going to have to go to break. Ladies and gentlemen, this is Siobhan Palmer with Platforms, the life-lifting news program for women. We'll be back to continue our conversation and look at my beautiful co-host, Asher. We'll see you in a moment.